Hello, my name is Adam Riedel. This is my intradermal medication administration video. For this, I need a few things: a multi-dose vial, which in this case is going to be pretending to be TB or tuberculin, a gauze, some alcohol, a 1 milliliter syringe with a 25 gauge needle that is 5/8 inches in length, gloves, hand sanitizer, and my pretend pad patient. So I verified the provider's order in the MAR for 0.1 mLs of tuberculin, and I'm also going to keep in mind the 6 patients' rights of medication administration, which is the right time, the right patient, the right medication, the right dose, the right route, and the right documentation. So I've gathered all my things. I'm going to go into the patient's room, knock, knock, close the door for their privacy, and then I'm going to ask them what their birthday and their name is for patient identification. They'll explain that to me, and then I'm going to explain to them or ask them for allergies to medication or food, which they will respond hopefully with no. In which just this case they did. And so then I'll introduce myself and explain what's going on. Hello, my name is Adam. I'm going to be your nurse today. I'm going to administer this intradermal tuberculin medication. This is to read for to see if you are positive or negative for TB. If you do come back positive in 48 to 72 hours, we'll probably follow that up with a chest x-ray. If you have any questions during any of this process, let me know. When I do administer the 0.1 mLs of tuberculin, then you will feel a slight sting. If you feel any have any side effects such as dizziness, rash, hives, things of that nature, it's important to let us know. Also, don't rub on this site after we put it in. There will be a little bit of a bubble sort of thing that will appear. Do you have any questions? No? Okay, we'll go ahead and get started, and I will use some hand sanitizer before I put my gloves on, and then use some alcohol on the top of the multi-vial syringe, since I have no idea how many times that's been used before. So, get my alcohol swab and wipe the top of my vial and get my 1 ml syringe out. And before I puncture, I'm going to get some air into there at 0.1. And then we'll release that air, and then our order was for 0.1 mL, so we're gonna slide it up to 0.1. And then I want to go ahead and tap the syringe lightly to get the air out. And then I'm going to use a different swab, alcohol swab, on my patient. And I want to administer this at a, I should probably show it what I've been doing. Hopefully that's showed everything. Crap. I want to administer this at 5 to 15 degrees, the angle. So we'll go ahead and make our C, and I'll spread in 15 degrees. And since this patient's, there we go. And since this isn't a real person, it didn't really make a blip on their skin because it's not a real person. And then we'll go like that. And then if there's a little bit of bleeding, we'll just gently use the gauze. And then we'll cap our needle until we safely hear it click. And then we'll dispose of this in the sharps container and take our gloves off, throw them away, ask our patient if they're doing okay, use some hand sanitizer, put the call out in reach, and I want to make sure that I documented everything under the 6 patient rights, which is the right patient, which we indeed have, the right time, which is right now, the right drug, which was tuberculin, right dose, which was 0.1 mLs, the right route, which was intradermally, and I am verifying and documenting that right now. Thank you very much.